I'm Barb Van Summeren. Welcome to Remote Care Conversations. And today I'm here with Becky Wagner from MD Revolution. Becky is the Director of Clinical Operations at MD Revolution. And today we're going to talk about a new program that's being incorporated into CCM and RPM programs, which is diabetes care management, and especially for CGM patients, continuous glucose monitoring. So welcome, Becky.
Hello.
So, Becky, tell me a little bit about what you are doing at MD Revolution on this new project.
Yeah, so CGM is a newer service for us that we're offering with remote patient monitoring. So we've been starting to build that program utilizing our standard RPM protocols, seeing how we can implement CGM monitoring patients' glucose in real time using a continuous glucose monitoring device and overlap that with our remote patient monitoring program.
So, I know you've been doing CCM and RPM and chronic care management, remote patient monitoring for those people who aren't acronym focused like we are so much, right? You've been doing this for a while. With the addition of diabetes care and especially incorporating CGM, how does that work? Do you have to develop protocols around that? And how do you develop a program, I guess, for that?
Sure. So the great thing is we are very skilled in remote patient monitoring and chronic care management, as you mentioned, and we already have a platform called RevCare that we utilize in monitoring patients and providing care. So CGM kind of ties right on into that. What CGM is going to allow us to do is review real-time glucose data, and it'll interlap with our other protocols, allowing us to monitor glucose in real time and identify patient thresholds. And anytime a patient is out of that threshold, we can take action in reaching out to that patient, doing a little bit of triage, and providing the care that's needed. So what it allows for us to do is take action in real time and have real-time data visible to us and also the providers, and just care for that patient. So a lot of what we already have in place for RPM and CCM services really intertwines with CGM. So a couple steps that we are looking at when we're implementing this new service of CGM is, what do those thresholds need to be? At what point do we need to reach out to that patient, do triage? At what point do we need to let their provider know or take further action in that patient's care? And those types of items could be anything as far as calling the patient, doing triage, calling the patient, providing diabetic education, and keeping a real eye on that patient and their vitals to make sure that we are staying on top of their health and that they are compliant and where they need to be for their best care and their best self.
Nice. Often feel like as consumers, we get so much information. So sometimes these new technologies can also be a blessing and a curse sometimes, right? So if I'm a patient right now who's managing my diabetes and utilizing continuous glucose monitoring, what problem, by combining these two, what kinds of new benefits will the patient have? And what are we solving for? Because today there's a lot of information. The question is it actionable for patients?
It can be overwhelming, especially for a patient who has diabetes who may be already using a continuous glucose monitor, but doesn't necessarily have someone that has eyes on that. So typically, a continuous glucose monitor tracks their glucose readings in real time on a very regular basis, about can be up to every 5 minutes. And for patients, that can be incredibly overwhelming to have a device that's constantly giving them a value. They constantly have to keep an eye on that. Everything they do throughout their day is going to impact their health and their glucose and their number. So it can be overwhelming. It also can be overwhelming to providers and practices when they're getting an influx of all of this data. So what our service allows is for us to take that relief off of the provider and their practice. We streamline that data through a secure platform. We get all of the readings from the patient CGM monitor through a secure cloud-based system that allows us to monitor in real time. And we set thresholds based on what the provider is looking for that patient, and for whether they want to trend that patient at a certain threshold. That's, if the patient exceeds a high value, reach out to the patient. We can set our thresholds at a patient level or also at a practice level. And so the relief that we're taking off of providers and patients is we're looking at this data in real time, we're analyzing it, and we're taking action so that providers don't have to worry about where their patients are at. We will let them know as we're kind of that middleman. And those patients know that there's somebody who is looking at their values in real time, and they can either call us anytime they have a question, a concern. Our clinical team is available, or they know that we're going to be assessing their values and reaching out to them when it's at a threshold that is concerning.
That feels really good because it's like I'm getting all the information now from these new technologies, which is great, right? But what do I do with it?
Right.
And in this case, it's I could actually call my clinician, which probably inundates them with phone calls, and maybe they don't even have time to respond to me on all these things. So this really is a great additional service for people who are looking for this for their patients. So let me ask you this question. You worked with luminary endocrinologist Dr. Safkan Guven on this project. What did he work on with you guys in developing this program so that you could make it available to endocrinologists, PCPs, and healthcare systems? What was his role, and how did you guys work together on this platform?
Yeah, so Dr. Guven provided a lot of his expertise as he's an endocrinologist and has a lot of experience working with patients with diabetes, but also has been in the field for quite some time. So he has been around different types of glucose monitoring devices. So we worked with him really to understand what is the best way that we can implement CGM into our current services, so remote patient monitoring specifically, to make it valuable for whole patient care, for providers, and overall healthcare. So a really big thing that I worked with Dr. Guven on is what does this look like to be successful for MD Revolution and our patients? And at what data points or thresholds do we set patients at to make this a realistic service where we're not going to be creating alarm fatigue for ourselves, for patients, or provider fatigue where we're reaching out to those providers too frequently, where our services are then not valuable. So Dr. Guven was able to assist me in creating our overall threshold protocol and also some ideas as we move forward on what is our service going to look like to add the most value. And I don't necessarily have an answer on what that's going to be as we're continuing to build it out. But once we get our first subset of patients and begin monitoring at the threshold or level that we've agreed upon that makes the most sense for the services that we offer, Dr. Guven and I will continue to work on how to make this program as beneficial as possible, as how do we continue to encourage these patients to monitor their glucose, to what education do we provide to them to help manage their glucose in the right thresholds to prevent episodes from occurring. So there's a lot of work that we've done, but still a lot of work that we have left to do.
I can imagine that's really important because people's blood sugar really fluctuates quite a bit during the day, right? And depending on what I eat or what behaviors I'm doing, so you don't want to overreact on making sure that you're reacting to every little blip or change. But this is the key to the visibility, right? We have visibility to this.
Right.
So how much care action do we take based on the visibility that we have? So he's provided some guardrails for you guys on, I guess if it's elevated for this period of time or looks like this is probably somewhere we want to intervene. Is that right?
Correct.
Good, good. Okay, well, that's fascinating. So, getting some rule sets together. And I love your term practical care, okay? Because that's what people want. They want responsiveness. They want to be able to monitor their care, but they want it to be practical, right? Like I can't change my behavior and take action every, 2 minutes on my sugar.
Yep.
So, I think that's the key, right? When do we need to intervene practically? And when can you guys insert and add value within the clinician relationship as well? So we talk a little bit about the value to patients because patients for sure get more visibility. Now they actually get a care team that's working with them on this with the proper guardrails so they're not scared or, overreacting to things. What about clinicians? What's the benefit to, let's say, endocrinologists, as you've discussed?
Sure. So the benefit for clinicians, are you asking more like for providers, like endocrinologists?
Yeah, I mean, you could say any clinician or clinician group. What's the benefit for them? And then, I kind of like to know what are some of the benefits for endocrinologists versus PCPs and, health systems in those areas.
Yeah, so there's benefit for any providers, any healthcare system. Endocrinologists specifically, they specifically care for patients with diabetes, and that's a very large part of their patient population and their priority. So our CGM program allows endocrinologists to gain valuable insight on the patient's glucose trends and patterns, which really enables them to adjust the diabetic care management plans for these patients. With CGM, as I was mentioning prior, we're getting readings more consistently, and they are proven to be accurate. Whereas without CGM, patients may just be doing finger sticks, may not do them on a regular basis, and it allows for a lot of inconsistency with reading, which makes it a little bit harder to create a diabetic management plan for patients. So, this really will allow endocrinologists to focus on diabetes specific, get readings that are valuable and accurate, and then be able to tailor patient care.
So you said that endocrinologists are specialized in diabetes care. So I'm sure real-time visibility to this is really going to actually elevate their care moving forward. What's the advantage for them to now incorporate CCM? Would they incorporate CCM or RPM into their diabetes care as well?
Yeah, they certainly can. And it's a huge benefit because all of those services together really allow, again, for that holistic patient care, the whole vision of the patient and how the patient is. So RPM and CGM kind of go hand in hand. If we're monitoring a patient on a continuous glucose monitor, that's going to be remote patient monitoring. And so, again, that allows for us to identify those glucose trends and patterns, provide some education. But RPM really manages and focuses on thresholds and values of that device. If we add on CCM, that benefit allows us to focus on whole patient, all the patient's conditions, and the patient overall. So CCM allows us to call a patient at least once a month, follow up with them, see how they're doing. MD Revolution specifically keeps it very patient centered and patient focused. So we try to take an approach of allowing a patient to guide their CCM conversation, tell us where they're at that month, how they're feeling, and maybe they have diabetes and we're managing that through CGM. And so we're focused on that, but also that patient struggling with anxiety and depression for the month. CGM allows us to take the time to add some additional focus on that patient, on their conditions, on their goals, and allow for that extra once a month touch base, minimal once a month touch base to care for that patient as a whole and not just focus on one condition or one value set.
That's, our wonderful friend, Jean Bogrowski said, it's about whole patient care in the future, right? And we're solving for data silos, but it's also about specialty silos
Sure.
sometimes, right? So, I remember Dr. Gluven talking to me about the glycemic control and that feature of the program and how he was very impressed by the data that we have available. Can you speak to some of that work and those specifics on how that benefits an endocrinologist?
Yeah, so I think overall endocrinologists are focused on maintaining the patient at a certain threshold, right? Maintaining an average A1C, keeping the patient in the same level consistently month over month. The issue with A1C in particular is that's only monitored, I think, at most every 3 months. Whereas if patients in CGM, we can monitor their thresholds and make sure that they are staying steady at a certain level consistently. And in our RevCare platform, the way we've designed the values to come in and us to identify where the patients are, we have a few different values that we can look at. So we can look at the patient's individual readings, but as I mentioned, they're coming in about every 5 minutes. So we've also designed it to see the patient's average. We can average it for a certain time of day. We can average it over days. We can see when they're typically high, when they're typically low, how many days in a row they're trending. So it really allows for a lot of insight in the patient's readings and a lot of different viewpoints to say what is going on with that patient's glucose.
You're elevating patient care because you have more insight to what's happening and you're able to actually have a control tower view. Or as Dr. Guven likes to say, this is like a window into your patient, really,
Right.
that this is providing. And with that window comes a better care actions, right, that you're able to take. So now I'm switching gears to PCPs. I would assume anyone who cares for diabetes patients would be interested in this new way of doing things. Benefits to PCPs, would they be pretty much the same? You can care for diabetes care patients at a greater scale?
Yeah, exactly. It would be the same. So primarily with PCPs, MD Revolution sees a lot of PCPs when it comes to chronic care management services. And we've begun to also tailor into remote patient monitoring, focusing on conditions that patients have. So if patients have diabetes, they can certainly qualify for CGM. And what that allows for the PCP is not only to see their readings, their glucose readings, but the PCP is taking a little bit of a bigger approach, caring for that patient as a whole, multiple conditions, their overall self. So those readings are going to play into all of the care that that PCP is providing that patient. So we can see, or they can see with the data that we're providing, what are these readings mean, not only for the patient's diabetes condition, but also for their other conditions, right? Diabetes can affect multiple aspects of a patient's life, including their other chronic conditions. And so it really is essentially the same benefits for endocrinology, but PCPs are going to have probably a little bit more of a holistic view
Yeah.
of that patient's care and their other conditions as well.
Yeah, I would think they can widen their scope
Right.
of services that they're able to provide, which is important because PCPs are often the vanguard, right, of, care and the spearhead when someone is noticing something that's gone wrong. Their first person that they're going to see is their PCP. So this is exciting for them too. And if they expand their care services, they will also likewise expand care service revenue for their practice, right? Good, good. Okay, now if you're a health system, now I'm flipping over to the health system. All I can think of if I'm a health system and I'm managing hundreds and thousands of patients, all I can think of, it would be really difficult to do this with individual platforms based on specialty. And to me, it would be beneficial to be able to cohesively manage my patients, whether it's diabetes care management, RPM, CCM, behavioral health, medication management, all these programs in one. Can you speak to how that would work for health systems? Do you do that for health systems?
Yeah, yeah, and there's a lot of benefits, right, to having RevCare for your practice if you're in a big healthcare system. So as we know, healthcare systems can be very large. One of the bigger benefits that can be very appealing is MG Revolution offers an additional clinical team onto your staff. So that healthcare system can utilize our specially trained clinical team to view their patients' care and keep an eye on their patients, monitor their values, and only send critical alerts or action needed that is going to be required from the healthcare system. So we're taking off the workload or ensuring that we're not adding any workload to that healthcare system. In addition to that, we can monitor multiple things, especially if we're staying on the topic of CGM and RPM, if we're monitoring patient values and doing that in between care. So typically I kind of explain it. We are the care in between patients' office visits, right? So we are monitoring those values. We can talk to the patient anytime, give them a call, but essentially with CCM, connect with them at least once a month. RPM, review their values in real time, making sure they're maintaining within that threshold. And again, that threshold can be anything that that healthcare system wants to set, either at a practice level or at a patient level. So it can be very detailed and patient specific care that we are providing. And then we rely or lean on that healthcare system or those providers if that care falls out of those thresholds, if that patient is having critical signs and symptoms, if that patient is constantly above threshold for multiple readings in a row, and we do triage. Based on our triage results, we're going to alert that provider and say, hey, this patient needs to get in for an appointment. Hey, you might need to change this patient's medications, etc. So for healthcare systems, we really are an extra layer of support that is doing a lot of care for your patients, that is allowing us to take some workload from you perhaps, and not piling on extra work to be the eyes and ears for that patient in between the times that they're seeing their provider.
Wow, that's a nice benefit, especially, with more information comes really, what do I do with it? More interpretation, more.
Right.
So you're kind of this level one support that clinicians can rely on to keep an eye on patients with this real time data, but then intervene with them when it's necessary and not for every single call. Cause I can imagine it could be overwhelming and it's really hard to get into my doctor for sure, let alone a callback, right, from my nurse practitioner. So I would assume that that's a real benefit for clinicians.
For sure.
Good. So, what's on the horizon? You guys have been doing some really big innovations. And I know that I also saw some information on some dashboards that you're doing. You're really able to put some technology into this visibility across the organization, across many, many patients, et cetera. What else is new on the horizon coming forward? So, practitioners can utilize your team, and if they have their own team, they can utilize the software. Is that right?
Yes. So RevCare is really our platform that's built to house our patients, and that's where we document all of our data and patient care, very similar to an EMR system. And that can be utilized in two ways. As you mentioned, providers can utilize our clinical team to care for their patients. So if they want to enroll their patients in RPM or CCM services or CGM, that's where we will do all of the monitoring for them, provide most of that patient care, and again, alert them based on the agreed upon protocols that we set. And what is wonderful about MD Revolution and our care team and the way that we structure our protocols is we allow those to be provider centered and practice centered. So those practices and those providers can choose what they're setting their parameters at, and we will monitor those patients based on their request and what they're looking for.
So it's not a one size fits all.
It is certainly not.
That's nice when you want to customize your care your way that you found that works in your protocols. That's really helpful.
Yes. And we, the way that our platform is built is we're very flexible in tailoring those services or those protocols at any time. So there may be practices who will start with us and they select a certain threshold, and then they realize they're getting too many alerts, or we're setting thresholds for patients who have certain conditions and those readings are expected. So we simply go in, we change what they're looking for, we'll change the threshold, we'll try that out for a couple months until sometimes it takes a little while, right, when you get started, to find the happy balance of what threshold is going to help those providers and their patients the most for the care that we're supporting them with. I always say kind of tailored to fit.
Nice.
Yeah. And then when it comes to providers or practices wanting to use our software, we also sell our software as a service. So our RevCare platform can be utilized by practices or providers and healthcare systems if they want to manage their own patients. They can get access to RevCare, and it is really a fantastic platform that MD Revolution has built over time that will allow them to manage and monitor their own patients. And they just utilize and reap the benefits of what RevCare has to offer, which is an endless list that I could go on and on about. But really, it allows for a cloud-based system that will bring in patient readings from their wireless device if it's RPM. And those providers or healthcare workers can review patient vitals in real time and then take the action that they need to care for their patients.
Beautiful. Well, it feels like this whole movement is really shifting toward more proactive care for people, more information, learning how best to place those care actions into place to really give our patients a lot more preventative and proactive health care, right?
Right.
Anything new on the horizon? What's next for your work here or any innovations that you guys are pulling together? So many things happening.
Yeah, so as we continue to build out our CGM program, we definitely have some work to do. As mentioned, our protocols and program will likely change over time as we get started. We plan to add additional clinical team members as resources for our CGM program, and those team members will be diabetic education certified. So we will have special diabetic educators who are able to not only review those patient vitals and read them in real time and provide their clinical expertise, but they're going to have that special training where we can provide the education for diabetes and all of the things that go with it.
Awesome. This sounds really, really wonderful. Well, Becky, thank you so much for spending a little bit of time. Definitely, if I were a diabetic patient or a clinician, I would definitely be calling you guys to help make my workload a little bit easier and help manage all this information that's coming in on patients now. So exciting stuff ahead. Thank you for being part of Remote Care Conversations.
Yes, thank you.